Williamson. I'm doing an instructional video on Stop the Bleed. This can be done if you have a patient or an incident where there's a single patient, multiple patients with single trauma or multiple traumas. Some of the things I'll be showing are the conventional tourniquet, which is designed just to be used as a tourniquet, an improvised tourniquet. In this case, it's a sling and swath. I modify it with a Coke bottle ring to secure the windlass that I will demonstrate. And then these are for extremities, arms and legs. If you have an injury in the junctional areas or in the abdomen, then you pack the wound, and I will show that. And then the final demonstration will be for a sucking chest wound, anything in the chest affecting the lungs. So we'll start off with the tourniquets. My lovely assistant is Andrew, and he has bilateral injuries to both legs. Determine which one you feel is the worst, and then start with it. You want to apply quick pressure to the junctional area. So I'm going to put my knee right in here where his artery's coming down and force that in there. It's not going to be comfortable. Your patient's going to be in a lot of pain. So as we do this, I get my tourniquet out. Quickly come up as high as I can. Try to avoid anything in the pockets that may affect the tightness of your tourniquet. Once that's done, begin turning your windlass. You turn the windlass until the bleeding stops, then go a couple more turns to make sure it holds. And then flip this over, and that secures it in place. Now I have the other leg, same type thing. I'm going to quickly come over. I can tie a knot. I use a pin as a windlass, secure that. Again, tighten till the bleeding stops. Slide it in the Coke band holder, and that will hold that one in place. It'll loosen these up here so he doesn't lose all the circulation. All right, you'll slide down and lay down. The next would be a wound in the junctional area or the abdomen. He's going to use his hands as a wound, and if this is the case, depending on the size, you may take a roll or two of gauze fully intact, of course out of the wrapper, and shove those whole rolls down in the wound. Then you'll take your last roll, pull the center out, and then you're just going to finger over finger pack that wound until it's tight. Okay, make a fist. When the wound is full, anything you have left you can put on top, have them hold pressure, and then you move on to the chest. If you have a sucking chest wound and they're having difficulty breathing, you may have to look at it and see that it's there, it's clogged up with blood, and they're having difficulty breathing. Air's building up. So stick your finger down in the hole, open that hole up, release some of that air pressure. You can take the plastic from your gauze, tape over top of it, tape it down in place, and that keeps more air from coming back in. Once that's done, roll them over. Look for exit wounds. You may have one entry wound, but multiple exit wounds. Again, do the same thing with that. You can have other dressings to apply on those. Once that's done, mark your tag on your color for triage and move on to your next patient. Thank you for your time and attention.